Jim, do I have to pick just one? There's
Actually, you don't.
okay. Well, I don't want to go
on.
on forever, but there's so much exciting stuff going on. I am so proud to be able to work with these two gentlemen and their organizations. The VA is absolutely a global leader in the use of health IT to deliver high quality care, and has been for a long time. Our colleagues at the DoD I'm really proud to point to their recent procurement of certified health IT that they're working on deploying now throughout the military health system. That was a big deal because that was a clear signal to the market in the private sector that certification is important. Certification being what ONC does. That's the authority that we have to certify vendors, health IT vendors, and their products to show that they have certain functionalities and that they use certain standards.
Certain criteria for standards to provide the care.
Yeah, exactly. I've been involved with the Precision Medicine Initiative, which has been just really tremendous, not just in terms of the excitement about the future of science and where that takes us, but really the cooperation that I've seen across the administration, our colleagues here and at NIH and the FDA, but also out in the private sector. Just the unbelievable excitement I've seen both from technology companies, from care delivery providers, from scientists, and honestly from participants that really want to get engaged in a research effort like that. We don't call them subjects. We call them participants because they're meant to be participants in that research initiative. I would love to talk about the technological development of application programming interfaces, APIs, which we think is a best way to give people their data and data about them. There's a gentleman I know called ePatient, Dave DeBronkart, who's been a real advocate for the past 10 years for engaged, empowered participants in their care, people who are getting their care, if you want to call them patients. But a foundational piece of that is people having access to their data. They didn't used to have access to their data in an easy way, even though they had a clear right to their data under the HIPAA law and regulations. But giving them the technological means to not just have to go to the office and pick up a copy, but boom, to have it on your phone, or boom, to have it on your laptop, or boom, to have it in the cloud where you can get at it. That's been a huge deal. I am going to pick the one thing though.
Okay,
the one thing has been the change in the business case for healthcare, and really that's been driven very strongly ahead by our colleagues at CMS and their value-based purchasing efforts. And here's what's key to it. So the IT. The point is not to have a laptop in front of a clinician, right? That's not the point. The point is people live longer, suffer less, and we get better value for the dollars that we spend, right?
Correct.
So we had this great incentive program, clearly drove the adoption of IT. Now you need to use that to deliver great care and for people to get involved with their care. So our delivery system reform efforts at HHS are changing the business case for how providers get paid for the care that they deliver. And we're going from a volume-based fee-for-service model to a good outcomes model. We're paying for good outcomes.
I like that.
Pay
for results.
It's what I want as a patient. It's probably what you want as a patient. And that's where we're going. And the key piece of that for us is that the IT is part of that. You can't get there without it.
Right.
So that's my one thing. Follow up on the telemedicine piece of it. It's tremendously exciting, and it's an example of how when you introduce these information systems and these information tools in, you can do things differently in ways that you couldn't before. I love to talk about Project Echo, which started in 2003 in New Mexico, led by Dr. Sanjeev Arora. Project Echo is conceived as a way of leveraging high-value assets like the gastroenterologist at the hepatology clinic at the University of New Mexico, whereas previously people would have to drive 600 miles from Truth or Consequences to Albuquerque. Now they could stay at their local doctor, get consultation from those specialists for somebody, in this case with hepatitis C, and they could be guided in their treatment of hepatitis C in a way that they really weren't comfortable doing before as primary care doctors. Right, I'm a family doctor. That's my background, and now this resource is available to them. Sanjeev did a study where he showed before using this, implementing Project Echo, there was a huge disparity between the cure rate for people who had hepatitis C in the rural setting versus those who came to the specialty clinic at the University of New Mexico. Wow. And then after Project Echo, the rate that disparity vanished. So it was an extension of these treatment and a leveraging of treatment. Sanjeev calls them force multipliers. And my colleagues here are actually using Project Echo now across the country, variety of conditions, and Sanjeev is going around the world. So that's a great example of how we're able to do things differently in healthcare.
That's cool.
Get better
that
outcomes.
Is a